Hi, I'm Dr. Courtney Katsur. I'm an associate here at Town & Country Animal Hospital. Today we're going to be talking about feline ultrasound. Ultrasound is really important because your basic diagnostics of blood work and x-rays sometimes can't find those little things that we really need to find, and it's not a full comprehensive workup. The ultrasound can actually image all of the organs thoroughly. You get a snapshot image with an x-ray, you get some idea of how the organs are functioning with blood work, but the ultrasound actually looks at the full image of a 3D view of that organ and to tell us if there's something wrong with it. And it can be very important, especially when we've exhausted all the other possibilities of diagnostics. We're just not finding what's going on. We have a cat that comes to our clinic frequently for urinary issues. And we had x-rayed it, didn't see any concerns. We've done urinalyses, urine cultures, and we just couldn't figure out what was going on. We decided to ultrasound the cat, and we actually found some bladder stones. There exists some bladder stones that you cannot see on x-ray, that you can see on ultrasound. And so we were able to do surgery to remove those stones, and the cat is doing well today now. It kind of is an adjunct, right? They all have their benefits, and sometimes you need all three, depending. But ultrasound is more of a 3D kind of view. You get to really get around the organ, see all the way around, and see all the surfaces in real time versus a snapshot with x-ray versus slices with CT. It's nice because you actually see things moving. You see much more movement, volatility going on in there. If you want to dig deep to see if there's something stuck and you want to see everything surrounding it, you get to get a real-time picture. So it's one of the best diagnostic tools. So the night before an ultrasound for a cat, you want to pull the food at midnight, make sure the bowl is not down, and you don't want to feed breakfast that morning. Make sure you also pull the water bowl that morning. You can use things like feel-away spray on the carrier for bringing them in to help ease them in their transition to the clinic. But we will give a light sedation here, and so we will be helping calm them as soon as they get to the clinic. With the light sedation that we give, they're very calm. So that helps ease us through the actual ultrasound, and they tend to do very well. Thank you so much for listening. I hope you learned something new about diagnostic imaging today. If you have any questions or concerns regarding this, please feel free to email us or call us.